my name's Kim and I'll be your Pilates instructor today. As an experienced physiotherapist, I can take you through safe and effective exercise. If you do feel pain, discomfort, shortness of breath or dizziness, or any concern about your vascular access, then please do stop and seek advice. However, if none of these things happen, relax and enjoy the movement. If you do feel concerned at all at any point, you may just sit down, find a comfortable position, breathe and imagine yourself carrying out the exercises that I'm describing. Okay, let's begin. So the aim of this morning Pilates session today is to stretch and activate through the key areas of the body, working on your postural positions, getting you set for the day. We're going to start off lying down and we're going to come up into a standing position. Now I know this can be troublesome for some, so do as much as you feel you are ready to do. You could start off in your bed if you like, or if you feel confident to come down onto a mat on the floor to get started, then do so. Just be aware that you could fall back asleep in bed, or you may find that you can't hit the right positions quite as well. So I'll leave it up to you to make your choice. All right, so we're going to start off down on the floor. Make sure you have a chair next to you to help you down onto the floor and also to help you back up again when we come back up into standing. So using the chair, coming down onto one knee, onto the other, come onto all fours if you would like, and then lower yourself down, turning over, taking your time, being careful of any vascular access that you have. Lovely. So once we're here, bending both knees up, your feet should be flat on the floor, toes pointing forwards, and feet hip-width apart. Think about train tracks down through the body, feet, knees, hips, all in line. You can have a pillow or a rolled up towel to support underneath your head if you feel like your neck and shoulders are more relaxed in that position. So we're going to start off with our Pilates positioning. Tuck through the chin, lengthen up through the back of the neck, broaden out through the front of the chest, not too forcefully, being careful of any vascular access that you have. Lovely. Pull those shoulders down away from the ears. These neck muscles should be fairly relaxed at this point in time, having just risen. However, we all have tension that builds up there, so make sure you draw those shoulders down away from your ears. Take a nice gentle breath in, breathing out and sinking and lowering those ribs down. Lovely. Rock the pelvis back and forth and settle in that halfway position. Just a nice little tighten through the pelvic floor to activate those deep abdominals and support the lower back and spine. So it's a relaxed but poised position. We're going to start off with some nice relaxed breaths, but slightly focused in the right area of the lungs, just to try to set you up through the day breathing correctly. When you experience pain and discomfort, it's quite normal to breathe just up here, very shallow. We want to get that breath down into the lungs. So if you can place your hands here, thumbs wrapped around the back, fingers around to the front there, and we're going to be taking some nice breaths in through the nose, with a slight pressure pushing in through the hands. Breathing in, feel those ribs expand, breathe out through the mouth, and you can have a gentle push in with your hands as you breathe out. Keep that gentle pressure on as you breathe in. So there's a little resistance to the breath in that will help you to breathe into the right place. Breathe out and push in gently. Maintain that pressure as you breathe in. Take these breaths at your own speed, breathing out and gently push into the ribs there. Just a couple more, concentrating on your positioning. Breathing in and breathing out. If this hand and arm position is awkward, you can rest your hands on the front of the ribs there. But just imagine that breath going into the lower outer ribs. Breathing in and breathing out. Lovely. Always take a second to reset your positioning. Tucking the chin, broadening the chest, shoulders down. ribs down, find that little arch in the lower back and tighten through the pelvic floor gently. Lovely. We're now going to lift each leg up to tabletop, this scissors exercise. Lifting and lowering, being careful not to swing the toes up too high, always thinking about pushing gently down into the foot. Good work. Relaxing but poised through that upper body and not worrying too much about that breath. Lovely. For the next exercise, we're going to bring the knees and the toes together. So zip the knees to the toes together. Lovely. We're going to be rolling the knees to the side. I don't want any extreme movements here, especially for anyone with any ports or access in the abdominal pelvis area. We're going to be rolling over to the side. I'd like you to pick up the hip and the foot. You will see this a little bit better when I go the other way. And draw back down. Lovely. Pick up the hip and the foot on the other side. And draw back to the center. Just notice these are not too extreme, the movements. Having your hands on your ribs at the front will help to keep those ribs in position. If you find yourself losing concentration at any point because of any background noise or disturbance from family members, then just stay with it. Try to just keep drawing yourself back into the movements in a relaxed manner. Lovely. And if you feel you can take these knee rolls just that little bit further to feel that lower back stretch. Of course, being as careful as you can at every point. Wonderful. We're now going to be stretching one leg out at a time, so make sure you have enough room to stretch that leg away. Tucking the chin, broadening the chest, ribs down, find that arch, take a nice breath in to start, breathe out and stretch one leg away. Good. You'll notice there that as I squeeze through my quadricep muscle, my heel picks up off the floor. It's really nice in the morning to tension through these muscles and then relax a little as you draw back in. Push the other leg away, squeeze through that thigh, the heel picks up just a little bit, and then draw back in. Always just thinking about your breathing being nice and relaxed. Lovely. And moving at your own speed. That could mean faster than I'm moving. Occasionally people move a bit more relaxed at a faster speed. Wonderful. Let's just do one more each leg. Relaxing that breath. Wonderful. Now a lovely exercise for the morning is the shoulder bridge. I'd like you to bring your heels as close to your bottom as you can, but not forcefully. I don't want you to try to bend joints that don't want to go that far, so just scoop them in just a little. You shouldn't have anything supporting underneath your head for this exercise because it can strain the neck as we lift up the hips. Just having your arms down by your side to start with. We're going to flatten the lower back and scoop in through the tummy. And then we're going to try to peel up one vertebra at a time. Only to this position. We don't want to try and push any higher and arch the back, just to here, like a ski slope. And as we come down, if we take a nice deep breath in first, not too deep, breathing out and sinking down with the ribs first and curling down. Just being mindful at every point about any extra ports or catheters you may have around this lower half of your body. So as long as you feel comfortable with the arms coming up above the head, again being careful of that vascular access arm, let's tuck under and curl up and bring the arms up above the head there, as long as you feel comfortable too. Curl back down and the arms come up just in front of you. You always come into that little arched position, that neutral pelvis, so that you can then flatten it and curl back up again. The arms come nice and relaxed up above the head. and curl back down. Breathing wherever you feel. Sometimes I like to take a breath in and breathe out as I come up. Take a breath in at the top, breathe out as I come back down again. Lovely. We're now going to come onto our sides to do some clam exercises. So rolling onto your side, prop your head in your hand here, as long as that feels comfortable. A pillow might be more relaxed with the arms straight, or in front of you here. Again, the neck should be supported. Tuck the bottom hip back, tuck the ribs back, scoop and tuck your bottom under, and push that top hip away a little bit. These are lovely to prepare for the day. They activate your glute muscles, which are there to support you as you walk. Good. You should only really feel this in the glutes here. It's okay to feel it just above the buttock line, but anything below that usually means you're starting to use some of the wrong muscles. Do these at your own speed and shuffle around to position yourself at any point in time. Great. It's lovely to keep this top shoulder nice and relaxed and your feet nice and relaxed. I see people gripping through the toes sometimes, and it's quite normal to not be able to lift that knee too high. Lovely. Let's move on to the other side. You can just roll over to the other side if you feel more comfortable to do that, but generally bringing yourself up, the legs around, and find yourself back in the same position on the other side. Lovely. Prop your head in your hand, tuck the ribs back, tuck those hips back, scoop and tuck the bottom under. That activates those abdominal muscles a little bit. Push this top hip away, the knee away, feet in line, and off we go. And if anything feels slightly awkward, readjust at any point. Remember to take these exercises at your own speed. I do prefer for them not to be too fast. Pilates should be controlled and relatively slow, but poised and relaxed in the right areas. Lovely. Okay. So let's stop there. One exercise that I do love to do in the morning is an exercise to open up the chest. So as long as you feel happy to be rotating and to prop yourself on this arm, you can maybe use a rolled up towel or a pillow there to support the head. But without anything, this arm can act particularly well. Stretch the bottom arm out in front. We're going to be breathing in as we reach up. You'll breathe out as we come over. I'd like you to try and keep the hips locked in that position we just described. And a relaxed breath as you come back. We'll do 3 on each side here. Breathing in, breathing out. Come back to the front. Breathing in, breathing out, rotating through the chest, keeping those hips locked. Lovely. If you would like, you can turn over onto the other side just by rolling over. I'll shift over so I can still keep addressing you. Bring that pillow around or just your arm as I'm demonstrating. Tuck the hip back, the ribs. Place your top arm out in front. Breathing in, breathing out, always taking care of any vascular access through that arm, making sure you're not overstretching or stressing the areas. Lovely. Feeling that lovely stretch of the upper back. This will help you to breathe throughout the day. Breathing in, breathing out. Lovely. Okay. While we're here, we'll take advantage of being able to stretch out our quadriceps. These muscles, the front of the hip and the thigh, can get rather tight. And it can give you lots of relief from any lower back pain by stretching these areas. If you feel uncomfortable bringing the foot to the bottom, we could always use a piece of rope or a dressing gown tie to pull using that. Or if it feels uncomfortable at all, as with any of these exercises, lie, relax, and imagine yourself following my commands. Lovely. We'll repeat that on the other side, and as I've described before, you can just roll over and listen to my commands on the other side. Get hold of the leg and pull back, tucking under gently with your bottom in order to stretch the front of the thigh there. Breathe with it. Lovely. And then we're going to come up into standing. I'd like us to come onto our hands and knees. Bring yourself closer to the chair if you need to use it to stand up. Now I would like you to really take your time with this. And if you feel dizzy at all, take your time halfway up, breathe, and then come up into standing in your own time. Now we're here, I'd just like you to quickly set your standing position for the rest of the day. Feet hip width apart, knees slightly soft, hands on the hips here. Scoop and tuck under the bottom gently. Draw those ribs down. Broaden out through the chest, all very similar to lying. Tuck the chin gently and lengthen up through the back of the neck, but not lowering your eye line. Lovely. Take a couple of breaths. In through your nose, out through your mouth, and again, in through your nose, out through your mouth. Lovely. So I hope you've enjoyed that morning Pilates session, bringing you gently up from lying down into standing. Try and take some of those principles with you through the day, holding a lovely poised posture throughout. Okay, I'll see you on your next session.